Welcome to the Perry Health Pulse podcast, a program dedicated to taking you behind the scenes of healthcare, sharing firsthand knowledge from healthcare professionals, and putting you in the driver's seat on your journey to lifelong health and wellness. Listen and learn about how healthcare delivery is changing on our weekly podcast.
On today's episode, we're going to be talking about COPD. It's a chronic condition that's becoming not necessarily more widespread, but people are a lot more aware of it and aware of the ways to manage and treat it. So we're bringing on two of our experts here from Perry. We've got Tim Schultz, Director of Respiratory Care. He's been directing the respiratory care services for the past 20 years. We've also got Jan Pistel, who is the Cardiopulmonary Rehab Coordinator for the past 10 years, and she's got a new program going focused on that pulmonary aspect. So welcome.
Thank you.
Thanks.
So starting out, for anybody who doesn't know, what is COPD?
COPD stands for chronic obstructive pulmonary disease. It's a fairly common, unfortunately, disease that affects many people in this country. Starts off with some shortness of breath and can progress to serious shortness of breath and really disability long term. So it's a serious situation.
What are some of the causes of it?
The biggest cause, I think, is smoking. It has been proven over the past several years, though, that in addition to smoking, people who've been in work environments that are contained with chemicals, body mechanics that are in dust and different types of situations like that are really common nowadays, that they're being diagnosed with COPD later in their life. And they'll say, I've never smoked. And that's what we're finding, is that there are a lot of people, after they've worked for several years in these environments, are now developing this type of disease.
Now, obviously, COPD affects the lungs. Are there other parts of the body that it ends up affecting then?
With COPD, many times patients' oxygen levels aren't as high as they normally would be, and that cascades on basically all the organs in the body. The heart works harder because it's trying to circulate the blood with the oxygen through to oxygenate all the organs of the body. So if the oxygen level is lower, it's going to have an impact basically on everything.
They also become extremely deconditioned because it's a struggle to do any type of activity. So once they get into the latter stages of COPD, or even the early stages when they start to become short of breath with just walking across the room, they tend to be almost solace in what they do. They don't want to get up, they don't want to move, because it's a struggle. It's very debilitating. So as they're become very solitude in their life, they just continue to decondition, and then it just cascades to the point where they don't do much of anything.
Now, you mentioned that there's some later stages. Can you go through a little bit about what the different stages of COPD might look like?
It ranges the categories from mild to mild intermittent to moderate to severe. These really are categorized in a few different ways. One of the best ways we have to diagnose and categorize these is through pulmonary function testing, which is a fairly simple breathing test that people can come in and have done. And it really pinpoints exactly where their breathing problems come from and how severe their issue is. Based on those stages, decisions can be made to help to treat that patient and hopefully slow the progression of that disease process. Awareness is everything. If people are aware of a problem, oftentimes then that will motivate them to quit smoking or to stop their exposure to whatever is harming or damaging their lungs, or at least cut it down or start wearing respiratory protection if needed. So that really is key to diagnose this as early as possible, so that measures can be taken to, as I said, slow the progression of the disease process.
Is COPD something that can be cured?
There's not really a cure for COPD. The best thing to do is to get it early and get it managed. Once the lung tissue is damaged, it's pretty much damaged. Wouldn't you agree, Tim?
I agree, yeah.
So that's why it's very important in the COPD process is to getting the providers to recognize, well, first getting the public to recognize that if you have symptoms of shortness of breath or difficulty with your everyday tasks, to consult with your provider so that some diagnosis can be completed. Once COPD is diagnosed, the earlier that we can get them into programs such as the pulmonary rehab program here at Perry Memorial, the better off the patient's going to be. The longer the patient or the person waits with that diagnosis of COPD, as the COPD gets more and more severe, it's more difficult for them to get to a maintenance level to where it's easier for them to do their everyday activities.
Well, and you mentioned that if it's not taken care of, a lot of times people just kind of shut down, they stop being active, and then it really escalates. What are some of the other things that can really lead to if people don't manage it?
The biggest thing is it's going to lead to a very, very poor quality of life. They become extremely sedentary in their lifestyle, and they get to the point where they don't want to go out in the public. They don't want to go to church anymore. They don't want to go out and socialize with people. And doing so, just like the old adage, if you don't use it, you'll lose it. So if you start to slow down in your activities, it's just going to continue to spiral downward. And then, of course, the end result is this is not a nice disease, and end-stage COPD, we've seen it many, many times over the years. To put it nicely, it's not a very easy way to die. But death ultimately is the end result in advanced COPD.
Let's pause for just a moment to thank our sponsors.
It's time to treat yourself to a woman's healthcare experience. The Perry Memorial Family Health Clinic providers understand the lifelong care needs of women. Trudy, Karen, Anna, Bianca, and Abby value their relationships with female patients and have the experience to educate and support you in making the best choices for your long-term health. Give Perry Memorial Family Health Clinic a call at 815-875-4531 and schedule your appointment woman to woman.
COPD is one of the leading causes of hospitalizations too, or hospital readmissions. What is it that happens there that causes people to end up in the hospital?
Well, people with COPD, as Jan mentioned, if they're not as active, just not being active can make it more prone to infection and things like that. The damage that's done in the lungs and the bronchial tubes, a lot of these patients, they have excess bronchial secretions. A lot of people talk about a smoker's cough. Get up in the morning, cough. They have productive coughs with phlegm. Having excess mucus in your system is just sort of makes you more susceptible to catching colds, getting pneumonia, infections of all sorts of the respiratory system. So these people are very sensitive to these types of things, and when they get an infection, it becomes much more serious than your normal person much more quickly. The body's immune system tries to fight off infection by producing more phlegm to try and clear those lungs out. And this can cause all sorts of problems for these people. Their lungs can basically plug up where they need to come in and have serious breathing treatments just to keep their lungs opened up and clear. So if these sort of patients let this go too long before they come in, it can get real serious real quick, and they may need to go on life support equipment. Just having COPD kind of lends itself to a lot more serious complications with relatively common infections.
And with the decreased lung efficiency, I should say, is there at any stage, is it anything like having asthma or an asthma attack?
It can be very similar to that, actually. Similar processes, depending on the type of COPD. There's a couple of main types. There's emphysema and there's chronic bronchitis, and those are differentiated through histories and pulmonary function testing and that. But when people have exacerbations of their COPD, or when their COPD becomes worse, oftentimes they have very similar symptoms to a person with an asthma attack. Their bronchial tubes swell and get inflamed, which narrows them, makes breathing even more difficult than their baseline. And their baseline is already, a little harder than it should be. So these people present very much looking like an asthmatic. The main difference with asthmatics, generally, asthma is considered reversible, so we can give them bronchodilator breathing treatments, and they'll start to open things up and much more quickly than someone with COPD. Some COPDers don't reverse with that type of therapy very quickly.
And I know you've mentioned some of the symptoms of early onset COPD, or for people who haven't been diagnosed, what are some of the signs that they might want to look out for?
Well, like Tim mentioned, the cough, especially a chronic cough. And again, I want to point out that it doesn't have to be someone who's been a smoker. It can be anyone, even having been around secondhand smoke for many years, can lead to COPD. So that chronic cough, that morning cough, especially the shortness of breath with any type of exertion, there are things that need to be ruled out. Of course, they rule out a lot of the heart issues first, and then if those all come back negative, then they'll lead more toward the respiratory issues. And again, do the pulmonary function testing to determine the level of functioning of those lungs. Those are the biggest early signs are, shortness of breath on exertion and the coughing, and especially the production of any kind of mucus.
Now let's talk a little bit about what services are available here at Perry. I know we're expanding the pulmonary rehab program to treat more patients with COPD, but for anyone who has COPD, what's the process that happens here? What's available for them?
Well, one of the first things would be the provider would refer them to our pulmonary rehab department. We would evaluate if they've ever had a pulmonary function test completed. If not, then we would refer them to Tim's department to get that pulmonary function test done. Once that test is completed, there are some percentages that we look at to see if they qualify for the pulmonary rehab program. And according to the standards, they need to be in a moderate category of COPD. So the percentages need to be, about midline of where they would be if they were perfectly normal lungs. So if the pulmonary function test comes back, we've evaluated the numbers, and they are a candidate for pulmonary rehab, then we give them a call. Our pulmonary rehab program is a 3-day-a-week exercise program where we utilize several different types of machines, exercise machines. We have Airdyne bicycles and treadmills, recumbent stepper machines, arm bikes, a rowing machine. So we have a lot of different exercise equipment, and our goal is as we exercise, the heart rate will increase, and when the heart rate increases, it helps to filter that blood into the lungs and helps increase that perfusion across that membrane line to increase the function of the lungs. We mentioned earlier that COPD is not curable. You're not going to cure it, but our big goal for pulmonary rehab is to get them in a state where they are still, I want to say, rehabable, so they aren't so debilitated and so deconditioned that they can barely make it into the building, but someone who's going to have the ability to put forth effort into the exercise, and then over a period of time, it has become very positive, where we've seen great results over the past 10 years. I have personally with pulmonary patients who we've been able to keep them off the oxygen, which is an end stage thing. Once, the oxygen's not crossing that barrier, they end up having to have supplemental oxygen. So keeping them at a good exercise state and a good mobility state, keeping the body moving and the air flowing, is really proven to be great success in our program.
So it sounds like as using exercise to build those lung muscles to make that capacity as much as it can possibly be, because you said the damage isn't really reversible.
That's right. Yes. So we want to, and if we get them at an early enough stage, would you agree that we may be able to bring them a little bit better, but we're never going to cure the COPD diagnosis. So the exercise also helps with that conditioning piece. So they're totally, they're starting to become deconditioned. They don't want to do a whole lot because every time they do something, it makes them short of breath. So the earlier we can get them moving and get the blood flowing and get the oxygen moving, then the better they're going to be.
The other part that Jan's department really does a nice job with is the educational part during this rehab program. We talk about all sorts of topics and things that these patients wouldn't think of, that maybe that's going to help them in their day-to-day lives, dietary things, what foods may cause you to have more trouble breathing, any gamut of things, the medications that are available, how to properly use their oxygen, if they use oxygen, things like that. So it really is a valuable service in not only maximizing their potential and their ability to do more with feeling less shortness of breath, but also just to educate them and kind of cement in the things that they need to be doing to make their quality of life as good as it can be.
Absolutely. And I think a major takeaway for people listening is if you have COPD, even though it's kind of scary that it can't be cured or can't be reversed very far or anything like that, it's a huge positive that it can be managed and you can be helped along the way. There is support to make sure that your lifestyle isn't terrible and that you don't have to go through very nasty end of life stages that Jan mentioned. So thank you so much, Tim and Jan, for this information about COPD.
Thank you.
Thanks, Tim.
It doesn't stop here. Access other podcast episodes and resources related to today's episode by visiting www.perrymemorial.org/podcast.